This next lecture series is going to be on benzodiazepines. And I think at this point you probably know how they work. Basically, they potentiate GABA. And what they do is they enhance the function of the channel. So this is the GABA receptor. GABA is the neurotransmitter, of course. Excuse me. And in order for the benzodiazepine to work, the endogenous neurotransmitter, GABA, must be present and bind to the GABA receptor. And so there's a GABA component to the receptor where the neurotransmitter, the endogenous neurotransmitter, binds to. There's also a benzodiazepine binding site on this receptor, and when both of those two binding sites are engaged, which is shown here, you can see the channel opening and chloride entering and causing hyperpolarization of that tissue. Okay, and so from a benzodiazepine perspective, we've got short-acting and long-acting drugs, and we'll elaborate on those in a few minutes. And the side effects are anywhere from very mild to potentially very dangerous, and I'll show you how that side effect profile can rapidly grow. So these drugs are used for sedation, but of course if you're using them for something like epilepsy or even panic, sedation can be a little problematic and kind of outside of the realm of what you're trying to treat. They're also anxiolytics, and so patients that do have a variety of disorders where they're overly anxious would do well on a benzodiazepine. They can also induce nausea and vomiting, of course, and there are different metabolites that can circulate and have different clinical effects. There is a benzodiazepine antagonist called flumazenil, and we will describe when it's appropriate to use these drugs, or this drug, in a few slides. So let's talk about what's called the ceiling effect. Oh, and then from a clinical perspective, it's got the same outcomes. So in terms of panic attacks, we'll reduce the frequency of the attacks, we'll reduce the severity, as well as the phobia associated with them. So let's examine what's called the state-dependent function of the benzodiazepines. And so basically, as the dose of benzodiazepine increases, the amount of available GABA basically runs out, right? So there's only so much endogenous GABA that can potentially bind to the GABA receptor. And we said in order for that benzodiazepine to work, GABA has to be present. And so as you push the dose of these benzodiazepines, there just simply isn't enough GABA endogenously in that environment to maintain that drug's effect. Okay, and of course, as the dose of the benzodiazepine increases, there's actually less stimulation for GABA to be released, and so it's kind of a twofold mechanism. And so that twofold mechanism kind of brings us to this concept called disinhibition release, which you may have heard about from other faculty at some point. But basically, remember that the brain is a predominantly inhibitory organ. Okay, and so the number of inhibitory neurons basically outnumber the number of excitatory neurons. Okay, and so just in terms of generalities, the inhibitory neurons tend to be small and relatively unmyelinated. And then if you give a CNS depressant, and we'll talk about several CNS depressants in the next couple of weeks, you really shut down the inhibitory activity first. Okay, and so that's this paradoxical site of excitement. And then as the dose increases, the overall inhibition takes over, shutting down excitation. And so this is a phenomena that, when we describe it, in these words, it sounds very abstract, and it kind of brings the point of GABA. So there's only so much GABA in the system, and then when you potentiate it, you basically kind of run out. But the best way to kind of describe disinhibition release is actually it's pretty fun. It's a cocktail party. Okay. and these are groups of drugs that are, there's a kind of a fine line between drugs that are sedatives versus drugs that are hypnotics. Okay, and so sedatives are really your anxiolytic drugs, and they reduce anxiety and make you calm. And so this is really why we serve alcohol at cocktail parties. A lot of people are shy, or they maybe wouldn't want to talk to strangers. And if you have a glass of wine or a beer, um, all of a sudden now you're not as shy. And I think many people have experienced this, right? Well, this is with one or two beers or one or two wines. As you increase the dose, you can see hypnotics. And so hypnotics are drugs that produce drowsiness and encourage sleep. And so, a flight of microbrewed beers or just general reading of pharmacology and studying neuroscience can produce hypnosis. Okay, and so this is really kind of disinhibition release. And so we're approaching wedding season right now. And if you want to see disinhibition release in action, look at your mom or grandma or somebody at the wedding who isn't really a drinker, maybe a social drinker, and they have one glass of wine or a glass of champagne. And as soon as the music comes on, they're on the dance floor. And you've never seen these people dance in your life. And now all of a sudden they are leading the conga line, or they're doing the Macarena, or they're singing Havana Gila, or doing something that you've never seen before. And that's really disinhibition release. And that's really kind of, you know, uh, ma masking the reservation of a lot of these patients, and then just a little bit of this drug just takes it away. Okay, and so benzodiazepines are your classic pharmacologic sedatives, and of course, in terms of over-the-counter medications, your cheapest and most available over-the-counter sedatives includes alcohol. Okay. Okay, so enough about disinhibition release and drunk grandma on the dance floor at the wedding. Let's go back to benzodiazepines. And so, from a kinetic standpoint, a lot of these drugs have really long serum half-lives, upwards of 90 hours. Okay, but the duration of action, where you actually see the production of sedation or the patient's experiencing a reduction of anxiety, is much shorter, in the magnitude of hours to days. So why is that? Well, that brings up kind of another classic pharmacokinetic concept called redistribution. And we don't really see it outside of the brain. Well, we see it outside of the brain, but we don't see it to this degree or to this magnitude outside of the brain. And so these benzodiazepines have a very wide duration of activity. You can subclassify the benzos into short acting, intermediate acting, and long acting. Okay, and their activity really depends on their chemistry. And so these short-acting drugs are extremely lipophilic, whereas these long-acting drugs are least or less likely to be lipophilic. And so that bothers students as well. Let me elaborate on that. And so the termination of drug action is primarily a consequence of redistribution. Okay? And this diagram sums it up really nicely. So here's your volume of distribution. Okay? And essentially, the larger the volume of distribution, the smaller the partition coefficient. And basically, we're looking at how quickly the drug can go from one compartment to the next. The volume of distribution really gets at the drug's solubility in water, right? In different compartments of water. So whether it's whole total body water or some of the other subcompartments in terms of interstitial fluid and so forth. In order for these CNS type of drugs to have a very quick effect, they need to get into the brain very quickly. All right. But the problem is that the brain is a lipophilic organ and the drugs are lipophilic. And so while they may enter very quickly, they may also leave very quickly. And so that's kind of what basically this is showing. Okay. These drugs that are extremely lipophilic, such as triazolam or pentobarbital, go right into the brain, and just as quickly as they enter the brain, they leave the brain and redistribute to total body fat. Okay? Now, in contrast, these drugs, let me go back here, these drugs, Valium, okay, which is diazepam, are least lipophilic, so it takes them a little bit of time to get into the brain. But once they do, they don't leave as quickly. And so this is the concept of redistribution. Okay, this comes into play with a lot of the CNS acting drugs, but it's also an important concept not only for benzodiazepines, but as well as the anesthetics. And so we'll talk about redistribution again when we do anesthetics, which is not going to be in this brain behavior and cognition course. I moved it to another course so that you guys don't have as many drugs to learn in one block.